Hey everyone, so today we are continuing our talks on psychiatric drugs with stimulants and other medications for ADHD. So let's get started. So what is ADHD, otherwise known as attention deficit hyperactivity disorder? ADHD is a chronic brain disorder, meaning it happens for a long period of time. A person has to live with ADHD if they develop it. And those symptoms include difficulty sustaining attention, being unusually or abnormally active, and impulsive behavior. Now, ADHD may manifest differently in different people, especially in different age groups. Childhood ADHD looks different than adult ADHD, but in general, those three main symptoms are what characterizes ADHD. Now, the onset of ADHD normally begins in childhood. That starts before the age of 12. However, we have to be cautious when diagnosing ADHD. Why? Because children who have problems in school but get along well at home with friends are likely struggling with something other than ADHD. So the same is true of children who are hyperactive or inattentive at home, but maybe their schoolwork and friendships remain unaffected. And this is common of any disorder, right? A disorder means there's some sort of disruption to actual daily living, as opposed to kids who might just need some more structure at home or at school in order to behave in a way that is more attentive and less abnormally active or impulsive. So risk factors for ADHD, they include a whole number of things, but many of them are, there may be genetic risk factors. So if they have a parent with ADHD or a sibling with ADHD, they may be more likely to develop it as well. There's also some research that suggests that environmental toxins like lead, maternal drug use, smoking, or alcohol during pregnancy may also influence and make someone more likely to develop ADHD, as well as premature birth. Apparently, preemies are at a bit higher risk of developing ADHD as they grow older. Now, in terms of treating ADHD as a brain disorder, it cannot be cured, but it can definitely be effectively managed with lifestyle changes and or pharmaceuticals. So many non-pharmaceutical options, which are especially popular in children, are behavioral therapy, family therapy, and psychotherapy or talk therapy are quite common as well as exercise and increasing physical activity. A lot of times kids with ADHD, they just need an outlet for their excess energy. So many times that might be sports, that might be clubs, could be drama, it could be theater, it could be soccer, swimming, you name it. Sometimes they just need that extra time to burn off what extra energy they might have, and they're able to apply it in a constructive way, and it can actually lead them to being quite productive and even prodigious. I'm pretty sure, I want to say Michael Phelps had ADHD, and that's one of the reasons why they put him in swimming. So a lot of times non-pharmaceutical options can have very beneficial effects for these kids and young adults. Furthermore, medication options include two types. You can have your stimulants or your non-stimulant ADHD medications. So our stimulants include methylphenidate, which you've probably heard of as Ritalin. Concerta is also another brand name of methylphenidate, as well as some others. We have amphetamine and dextroamphetamine combined into one pill, and that is known as Adderall. And then we also have lisdexamphetamine, or Vyvanse, which is also quite popular. Non-stimulant ADHD medications include atomoxetine, or Strattera, guanfacine, which is an extended release formulation, also called Intuniv. And there are some other antidepressants as well, which may be used for ADHD, but we're not going to cover those today. So focusing on stimulants for ADHD, I want to draw your attention immediately to that big C2 sign. All of the ADHD meds are C2 or Schedule II medications. So they do have a significant risk for abuse, misuse, and or dependence. They are commonly misused by students, especially college students who want to cram the night before an exam, or they want to be extra great with their studying, extra focused, even sometimes to get high from snorting Adderall as well. It is possible as well. So it is a very, very commonly abused drug, especially on college campuses, unfortunately. And many people use it as they think it would be a study aid, although it really is not that effective for students who do not have ADHD. It doesn't affect people who are, I guess you could say, neurotypical, who do not have ADHD. It does not really give them a greater focus. In fact, it might distract them even more. than it would for a person who actually needs that medication in order to function, because the brains of people with ADHD versus the brains of people who do not have ADHD are quite different. Now, stimulants, the way they work is they work by increasing the activity of the neurotransmitters norepinephrine and dopamine in the brain or central nervous system. Now, this balances and boosts the level of these neurotransmitters in ADHD patients, which allows for more typical brain function. So it essentially regulates the imbalance of chemicals within their brain and allows them to function in a way that is more productive and focused. Now, examples of these stimulants are methylphenidate, which is super, super common, Ritalin, Concerta, and some others. And it's available in tablets, immediate release, extended release, as well as an oral solution. So that's good, especially when you're prescribing methylphenidate or other stimulants for younger children as well, who may have problems swallowing pills. Next, we have Adderall, which is the combination of two different amphetamine salts. It's amphetamine and dextroamphetamine. Capsules and other mixed amphetamine salts or tablets. You can see those little salts. It's inside the Adderall capsules. They're quite interesting. That the fact that the capsule itself is transparent. So whenever they're probably one of the coolest looking drugs, at least in my opinion, when you're actually counting them, because of course we know we have to do that narc count every week or so, depending on the institution in which you work. And lastly, we have lisdexamphetamine, which is just another type of amphetamine salt, otherwise known as Vyvanse, and that comes in capsules as well. So switching gears a little bit, the other time when we would use stimulant medications, there's actually for narcolepsy, which is sort of you could almost say it's the opposite of ADHD. It's a brain disorder that causes overwhelming daytime drowsiness or sudden attacks of sleep, regardless of how much sleep the person got during the night. So sleep attacks in people with serious narcolepsy can sometimes be triggered by strong emotional responses or stimuli. So say if a person gets scared, if they went to a haunted house or something like that, and someone jumped out and scared them as a prank, they might immediately faint. They go to sleep because of the imbalance of chemicals and neurotransmitters, specifically norepinephrine and dopamine within their brains. It just sort of short circuits and they immediately fall asleep. Likewise, sometimes if a person laughs too hard, they may also fall asleep and have a sleep attack, even when they're trying to be focused on something that might be a serious activity, such as driving a car or taking a test or you name it. Now, the main drug that we use for narcolepsy is also a stimulant medication. It's also used for actually sleep apnea and shift work sleep disorder. So if someone's working, say, the third shift or something, and they suddenly are quite off in their circadian rhythm, you might be prescribed modafinil or Provigil. I like to remember Provigil because vigilant, right? Vigilant means you're up and awake and watching things. Provigil, it's provigilance, right? So it's going to keep you up. It's a stimulant medication. It's a C4 medication, a Schedule 4 medication. So it does have some risk of dependence, abuse, misuse. Available in tablets, but it's generally very, very well tolerated, and it can make all the difference for narcoleptic patients. Side effects may include headache, nausea, anxiety, and, as one would expect with the stimulant medication, insomnia, inability to fall asleep and stay asleep. Now, stimulant side effects and important notes. As I said previously, stimulants for ADHD, so our methylphenidates and all of our amphetamine salts, those are all C2, Schedule 2 medications with significant potential for abuse and misuse. So they can be addictive, they can be abused, and they can be quite dangerous when used in that manner. Now, we also have to have caution in patients with other psychiatric disorders as well. So stimulant medications might trigger mania or a manic phase in patients with bipolar disorder, which is the last thing that we need. Especially also with patients with a seizure risk, they could increase the possibility of a patient developing seizures if they have epilepsy or some other similar disorder. There's also a possible increase in suicidal thoughts with ADHD medications, stimulant medications, especially upon when they're first given to the patient. That being said, you can titrate them up, you can increase the dose slowly in order to avoid that. Now, common side effects are what you would expect if you're stimulating someone's nervous system: nervousness, anxiety, increased irritability, as well as as with many stimulants, there's a loss of appetite and weight loss that may come along with it, because if you have a stimulant medication, even a stimulant like caffeine, you don't get as hungry if you're caffeinated. So it sort of suppresses that need for food. And oftentimes that can cause people to lose weight if they're taking stimulants chronically. Another very, very important point before I move on to some other side effects is that you do not use these stimulant medications in patients with heart conditions like arrhythmias, a recent myocardial infarction or heart attack, and moderate or severe hypertension. Because the last thing you need for these patients who have a significant cardiac risk is to increase their heart rate with a stimulant medication in addition to everything else they might be taking. As you would assume with stimulant medications, another side effect is insomnia. Nausea and vomiting are also fairly common, as well as dry mouth. However, say a patient does have a heart condition or something like that, you may want to suggest non-stimulants for ADHD. So they take longer to work than stimulants. It's usually like several weeks until they get to a therapeutic effect, but they're a great choice for patients who can't take stimulant medication. So maybe they're too young to take the stimulants. A lot of the stimulant medications like the methylphenidates and other dextroamphetamine, Adderall, there is a age limit where they're not safe, particularly in young children. They're also great for patients who have a risk of substance abuse. As we said, those stimulant medications are Schedule II medications. They have a pretty significant risk of abuse, misuse. They're quite useful if there is a person with a risk for substance abuse. Now, they may also be unable to tolerate the side effects. If they have a heart condition, bipolar disorder, non-stimulants are probably the best option. Of the non-stimulants, the most prevalent, I would say, is Strattera or atomoxetine. And it's actually an SNRI. So we talked about our SNRIs with our other psychiatric medications and reviews. As with SNRIs, in addition to some of the other side effects, you can go look up in that lecture. Strattera has an increased risk for suicidal ideation. So the increased risk of thinking that you may want to commit suicide. It's not an actual increased risk of suicide, but the thoughts may be more prevalent, especially right when it starts, right when the person starts therapy with it. Side effects include headache, insomnia, drowsiness, loss of appetite, and decreased sexual function, which might include erectile dysfunction, as well as a possible increased risk for hypertension. Although, of course, that hypertensive risk is not nearly as much as it is with stimulant medications. Now, another one is guanfacine, which is a blood pressure medication, actually, and it's used to treat ADHD in children ages 6 to 17. So guanfacine you maybe see prescribed to children who have ADHD, and it's actually been diagnosed and they could benefit from a non-stimulant medication. So that's just about it. If you have any more questions on stimulants, feel free.